And today I'm going to discuss the opportunities for nursing professionals in Australia. Abdul, can you hear me clear? My voice is clear? And screen? Can anyone confirm, please? Yeah.
Abdul, can you confirm once search voice is clear or not?
Yes, yes, sir. It is okay.
Okay. Okay. We are an Australian organization and headquartered in Sydney, in Australia, where I'm currently presenting this presentation for you. So, as academically provide the assistance for all healthcare professionals like medical doctors, dentists, pharmacists, physiotherapists, lab technicians, nurses, optometrists, veterinary doctors. So, in general, any healthcare professional want to practice in another country, so they need to complete some steps. Like first step called document verification, then they need to write the exam and also need to write English test. Then they can migrate to Australia or any other country. So the same steps for nursing professionals who are looking to migrate to Australia. So this is about me basically. These are some of the faculties for this course. So if you see here, the top 20 occupations in the high demand in Australia, so nursing professionals is in the number one. So they need a lot of nursing professionals in Australia. They need more than someone who did a degree from IIT or some other premier institute in India. They need more than that nursing professional. Okay. So if you see here, the nursing professional are number one, and number nine, the medical doctors. They need GPs, and number 17 basically is the physiotherapist. So in healthcare professionals, the three occupations in the top 20 high demand occupations in Australia, and nursing professionals are in the number one. So just you completed the process, you will 100% you will get the job and your PR visa, and you can live and work with your family in Australia. So these are the opportunities for you if you are marketing as a registered nurse in Australia. So Australia provide 190,000 PR visa every year. This is for this year quota 190,000, and currently 18,000 plus job advertisement currently available on seek.com.au, means that they might be need more than 1 or 2 lakh basically the nursing professionals. Okay, so one advertisement might need 10 nurses, 20 nurses, 100 nurses like this. So even another article you can see here, the Australian need more workers for these jobs. Is migration the answer to solving our skill shortage? So you can see the nursing professionals are in the high demand. And if you go for seek.com.au, the website, they are mentioning that these are the job advertisement available, and these are the job growth. 14% every year is going to grow for the nursing professionals. High demand for next 5 years, and the salary for nursing professional around 83,000 Australian dollar is going to be a 45 lakh around Indian rupees per year. In job satisfaction also is very high, 3.9 out of 4 in Australia. Apart from these, there are some other advantages to migrate to Australia. For example, education for kids are free. So if you are migrating to Australia with your family, for your kids, education is free. You no need to pay any fees in the school. Okay. Again, if anything happened to you or your family, healthcare is free in Australia. In case of US, you need to buy the insurance there, private insurance, but here, the government itself will cover universal health coverage basically in Australia. Professional development. While you are working in any hospital and you want to attend any workshop or any conference or want to upgrade yourself, then the hospital allow at least they will pay you all of your bills at least 2 times if you want to upgrade yourself. Work-life balance. As in registered nurse, you need to work around 38 to 40 hours weekly, like 8 hours per day for 5 days you need to work. So you have a lot of time to give your family members. And yeah, career opportunities, as I mentioned, a lot of jobs are available. You will get the fast track PR visa, permanent residency, and quality of life obviously is very high compared to our own countries, and high potential earning as a registered nurse in Australia. So these are the some factors. Based on this, you must think about migrate to Australia. So the eligibility to migrate to Australia, they need 4 years bachelor degree in registered nurse, and you must be a registered nurse in the home country. These are the requirements. BSc nursing, or those first did GNM, then later they did like post basic nursing also, they are eligible. But diploma is not eligible, or otherwise they have at least 4 year bachelor degree holders. They are eligible to migrate Australia as a registered nurse. So these are some steps you need to complete in order to migrate to Australia. So first step called document verification. We will help you to complete this. Number two is the NCLEX exam. We will provide you with a 4 month coaching online, live classes from Australia, plus recorded sessions. So easily you can take this exam. An exam is going to be conducted in India itself. In and Chennai is the exam center. Bangalore, Hyderabad also exam center is there. So very easily you can crack this exam from there. Okay. And then number three step, you have to pass this English test. We will provide you the coaching for this as well. You can pass easily. So all these three steps you need to complete in India, and then you have to come to Australia to complete this step 4. Once you complete it and apply for registration, and here we will help you to get guaranteed job in Australia, 100% guaranteed job once you completed all this process from us. So you need English basically 7 band individual in IELTS, or B score in OET, or PT 65. So we need for your degree, transcript, work experience if you have any, valid passport, or government ID proof, passport photograph, nursing registration, and all these documents we need. So in general, NCLEX exam, they will ask you minimum 75 questions, maximum 150 questions, and total time for duration for the exam around 5 hours. And no negative marking for this. This is exam kind of like if you are given the uh, correct answers, you might receive 75, or if you are give some correct answers, some might be wrong. So you may get more questions to answer. Okay, and after 2 hours, you have a optional break for you. You can take after 2 hours if you want any break. So these are the exam centers in India like Bangalore, Chennai, Hyderabad, New Delhi, and Mumbai. So these are the 5 exam centers currently in India. And you can write, basically you are eligible to apply all the visas, whatever PR visa available in Australia, like 189, 190, 186 PR visa, and also 4849 regional sponsored visa. Also work experience, also work visa, also you are eligible to apply. These are some of the fees. I think Abdul will give you the more information regarding this. And we also have a financial assistance. So you can pay the fees in 3 months, 6 months, 9 months, or 12 months without paying any interest rate. This is the Eduvans is our financial partner in India. So these are some of the reviews from our students. Yes, so now we can take some of your questions.
On behalf
For Abdul, maybe you can just describe in Tamil for a few minutes, and then we can take some questions.
Good morning, sir. So
Yes,
this is regarding here. They want we can clear before coming to Australia. We can come over there with the residence this one visiting visa, and we can clear.
Abdul, I'm not clearly hear this question. Can you please?
ma'am is asking whether we need to take English test in India or we can go to Australia
Yes.
and take the English test.
Okay, English test you need to take in India itself. The first 3 steps like document verification, we will complete for you.
After survey, because few countries they have reduced from 6.5 to 3.4. In
7
Australia,
individual band required. 7 individual band required in IELTS. But you can go for PTE, very easy exam, PTE and OET.
We can take PTE or OET exam also, which is easy.
they can take either PT or OET also.
Yes, yes, yes. And these are the easier exams for nursing professionals as compared to IELTS. So highly recommended, go for OET or PTE.
Okay.
Yeah, if anyone score is coming like 6 in IELTS, so they can score 7 easily in OET or in PTE.
So, how long it takes for them to clear over there? And what is the new preparation when they start their preparation to reach Australia? How long it takes?
So basically, yeah, I not understand basically the question. Basically, there is a voice problem, but I understand that you are asking regarding the how many times you can give this NCLEX exam and how much duration required. I mean, the total process, right?
So ma'am is asking how much preparation time
Okay.
it takes.
The preparation time we will provide you for 3 months. For NCLEX, NCLEX preparation for 3 months, and for English 45 days
Right. English.
separately.
Okay, that's good. But since I have a student just coming out of the college, it takes another 15 to 20 days to get their results and they get their certificates. So, if suppose if a candidate is interested, if they start the processing now,
Yes, so basically now what they can do, they can enroll in the course, they can start preparation, and once they got the degree or any provisional degree from the university, then they have to go for registration as a nurse in India. Then only we can apply for them in Australia.
that's great because they have to have a parent country registration. Then only they can apply. Okay.
The registration as a registered nurse in India, it is mandatory.
Okay. Any other questions? If you want, you can ask in Tamil also.
Please ask in Tamil, English, or Hindi. Any in these 3 language you can ask.
Malayalam also. Malayalam.
Yeah, Malayalam also. Then Vamsi also is here. I mean, Malayalam, Tamil, and Telugu, Hindi, English. Any in this 5 language you can ask.
So what are the specialized nurses are there in Australia? Because in India we used to tell only the nurses, senior, this one, ward, in charges, like that. Are there some specialties maybe available because you're not aware of it?
Yes, there are so many facilities available, but you have to be a specialized nurse for that. Each they require basically the specific skills. So once you registered nurse in Australia, in general you can start working. And if you want to do, you can opt like short courses here, to become a very specialized nurse. For example, an ICU nurse or surgical nurse, or maybe geriatric. There are so many specialties here available in Australia.
Specific criteria or any extra certification they have to take to become a surgical nurse over there?
Abdul, can you please repeat?
Sorry, suppose if a student want to be a surgical nurse over there, whether they have to take any course over there?
No. Basically, you can be a registered nurse, right? Once you pass, this is like a general nurse. You are writing this exam, okay? And if you have previous experience, for example, in India, you are working in surgical nurse, definitely you can apply job and you can get. But if you are a fresher, you do not work in India anything in surgery, and now you want to work in surgery, then you have to be, you have to go for certain, training or short course. Then you can become, the surgical nurse.
Okay, sir. What is the duty timings over there? Work
8
schedules?
hours per day. 8 hours per day, and nursing professional need, like, 24 into 7 care, right? So it might, like, the shift might rotate, but 8
Okay.
hours you have to work maximum per day.
Okay.
And you have to work for 5 days. So
You
40
have to
hours
work for 5
weekly.
days.
Yes. In general, in Australia, you have to work for 8 hours per day for 5 days.
5 days.
And but many nurse I know personally from India, they work 6 days. So they got the additional salary for that. So if you are working beyond 8 hours, you will get the additional pay.
Okay. Sir, what about the legal support is there for nurses from when we migrate from India to Australia? Because their legislation is different. Suppose mainly for the patient safety or the errors which they commit.
No, nothing such, you have to basically just follow the instruction from the GP or the doctors, so you have to basically, and there is some, when you are going for first time, there will be someone who has to supervise for you, so you can learn basically, while you are working. So there is no
Oh,
separate exam for you to write for this.
okay, sir. Okay. Thank you so much for your
And like
greater explanation.
thousands of nursing professionals from India, they are working in Australia. So
Yeah,
if you
many of
go
my students are there in Australia.
If you go in any hospital, you will find a lot of nursing professionals, even doctors also, Indians, they are working. So no need to
Oh,
worry. Wherever you are getting any job, definitely someone will be Indian will be there.
okay. So what about the salary package when
Salary,
compared to India? Indian
salary
currency
uh, around 40 to 50 lakh per year.
per year? 40 to
40,
50 lakhs.
yes,
Oh,
per year.
okay. Per month, 4 to 5 lakhs it will come
Yes, around.
around. Okay, sir. It's very nice.
Yeah. And basically, very, very high demand. So once you pass the exam, immediately you will get the job. There's no need to wait, all those things. So they need a lot of nursing professionals in Australia currently.
Okay.
Any questions from a student side?
Sir, they need the presentation in Tamil, so I just give them in Tamil presentation.
Yes, yes, yes. You just you can brief in Tamil.
Yeah. So, Amin sir, can you please present me the screen, sir? Presentation.
Sure, I'll do that. Sir, if you want to continue, you can. We will handle the questions, sir, now.
Okay, okay, okay. Thank you so much, ma'am. Thank you.
Sure.
Bye.
Thank you, sir.
Thank you so much for your elaborate presentation, sir, and giving guidelines for the Australia process for the nurses. Thank you so much. On behalf of Sri Shanmugha Educational Institution, I wholeheartedly thank you for this career orientation program. Thank you.
Thank you. Abdul, I'm just presenting my screen. You can give that in Tamil, huh?
Sure, sure.
Yeah.
சார் இவ்வளவு நேரம் உங்ககிட்ட பேசிட்டு இருக்காரு. உங்களுக்கு ஏதாவது ஐடியா இருக்கா? நீங்க ஃபைனல் இன்னைக்கு போறீங்க இல்லையா? ஸோ இன்னைக்கு உங்களோட லாஸ்ட் டே நினைக்கிற காலேஜ். ஸோ இந்த டே வந்து நீங்க நிறைய லேர்ன் பண்ணி முடிஞ்சு வைக்கணும். இதுக்கப்புறம் நீங்க காலேஜுக்கு எப்போ வருவீங்க, ஸோ எதுக்கு வருவீங்க அப்படிங்கிறது தெரியாது. ஸோ லாஸ்ட் டே நீங்க உங்களோட ஸ்டேட் பட் completely useful for your it might be நீங்க ஜாயின் பண்ணலாம் இல்ல 2 years எக்ஸ்பீரியன்ஸ் ஆனவங்க ஜாயின் பட் உங்களோட கெரியருக்கு இந்த NCLEX எக்ஸாம்ன்றது ரொம்ப இம்பார்ட்டன்டாக இருக்கும். ஸோ இது இந்தியாவில் உங்களுக்கு 1 lakh சம்பளம். What is the salary in marketing? 20 to 20. After 10 years, 30. So Australia, total 3 years, 3 months salary, 2 to 4 lakhs. So we are trying to family take care of it. So next level legal எல்லாமே அப்படிங்கிறது ஐடியா இருந்ததுதான். Surely நீங்க டாக்டர். So கரெக்ட் மார்க்கெட் எல்லாமே நீங்க வந்து தெரியும். So நீங்க வீட்டுக்கு கூட இருக்க முடியாது. So அதுக்கு என்ன ப்ராசஸ் நீங்க என்ன பண்றீங்க அது நீங்க புரிஞ்சுக்கோங்க. ஏதாவது டவுட் இருந்தா தமிழ்லயே கேட்கலாம். So
Abdul, if required, I can share that presentation to you. You can open there.
Yes, sir. Please share it.
Sure, I am doing it here.